Now, classification of osteochondritis dissecans varies differently. Usually, the clinical picture is very pathognomic and it's very easy to actually diagnose this kind of a problem. But we always have different classification as this has different stages. Therefore, we have a Clanton classification for this disease. Now, Clanton classification is mainly based on the situation in which the cartilage and subchondral bone is. For example, as I told you, usually the problem starts initially with the softening of the cartilage. And when the softening of the cartilage with partial detachment of the underlying bone occurs, this is usually termed as Clanton type 1 or type 1 classification. Why this is type 1? Because this is mainly related to the very early onset or very early stage of the disease, in which the symptoms may be very mild or patient may be asymptomatic at times as well. And this is usually in which there is a depressed osteochondral fracture. Now, why this fracture occurs? Because the problem is in the subchondral bone and the cartilage has started to move out. Therefore, the area is actually unable to bear weight properly. This would lead to this sort of a depressed osteochondral fracture. From then type 2 comes in. This is a slightly more advanced stage of the disease in which the fragment is actually attached by an osseous bridge. As you know, that cartilage and actually the subchondral bone are separating. Sometimes what happens is that subchondral bone also gets separated along with the cartilage, and there's a very small hinge or osseous hinge by which some part of the subchondral bone and cartilage is actually attached to the main femoral condyle. This is actually type 2, and usually when this happens, this is very clearly visible on the X-ray. But depressed osteochondral fracture may present with slightly small sclerotic area with lucencies around it. Why? Because the whole of the subchondral bone is actually separated out of the main part of main femoral condyle. Now, coming to the type 3 is more advanced than this, in which there is actually detached but the segment is non-displaced. The whole thing has come out, but it's actually not going into the joint. It's still somewhere lying over there on the femoral condyle. The reason is there is no attachment to the underlying subchondral bone, and some part of the cartilage and subchondral bone is completely detached from the main femoral condyle, but it has not actually displaced into the joint and formed a loose bodies. But when that stage occurs, that it gets detached, becomes unstable and goes into the joint, this is actually termed as type 4, or this in which there is a displaced fragment forming a loose bodies. So with every type, there is actually advancements in the disease, and as the type progresses and increases, the disease becomes more advanced and more problematic, and more stuff is actually required to treat this sort of a problem. Because treating a depressed osteochondral fracture may be very easy and may not require any form of a surgery, but a displaced fragment which is acting as a loose bodies into the joint would require some of our surgery in form of an arthroscopy or arthrotomy. This is Clanton classification, which consists of from type 1 to type 4, and it actually defines the severity of osteochondritis dissecans.